Yo soy Lidia Puga y soy coordinadora de experiencia al paciente y servicios de idiomas. In Intermountain, in Colorado and Montana, we saw over 52,000 non-English speaking patients, and out of those, there were 67 different languages. In Colorado, the majority of the patients are Spanish speaking. I round on all of the patients that do not speak English, so that includes Ukrainian, Russian, ASL, deaf patients. And when they see me come in with the interpreter, and the interpreter greets them in their language, and I tell them what I am there for, their eyes just light up because they say, oh, okay, so I have an interpreter now. And they actually open up. They open up because they can actually speak to the provider. It's really awesome to see caregivers when they use the interpreters and they really get down to what the problem is. It makes a big difference. I'm going to share a personal story. My father had just passed away a few years ago, and my mom was just diagnosed with cancer a year later. I used to interpret for her for all her doctor's appointments, even though she spoke English, but she always needed me as her support. After a series of tests, we had an appointment with the doctor so that way they could review the results, and the interpreter was there when we arrived. They asked my mom. My mom said, no, Lily can interpret for me. The doctor started with, I'm sorry, Mrs. Puga, but I know we told you had at least a year to live, but you don't even have 2 weeks. I was speechless. That was my aha moment, because for me, I realized I was not doing my mother a service I was not doing the right thing by interpreting for her. I should not have been the one to have told her that. And because she always depended on me to do that, and I willingly did that, I didn't realize that we put the family or the loved ones in a very difficult position by asking them to interpret. So I would ask, keep that in mind. And I have to say that when I share this with patients and I tell them, you can have an interpreter here, you don't need to interpret, they tell me, thank you for that. Por eso a veces es importante tener a un intérprete calificado para que pueda asegurar que la información la esté recibiendo bien, que lo esté entendiendo bien. We have interpreters, and we can provide that for you. We will always have that available for you. So whether it's by phone or in person, we will always have that interpreter for you. I guess I can say that it is my passion, communication, not just for patients, but for staff, because it makes such a difference in everybody's lives. And I go home every day knowing that I made a difference, whether with the patients, most definitely the patients, but also with the staff.